Our presenter tonight, Dr. Andy Izuka, will be talking about how the landscape looks like for the foreseeable future, when we can expect a vaccine and how effective that vaccine will be, and what we can do in the meanwhile to live with this virus in our everyday lives. We also will be interviewing someone who was diagnosed with COVID and has recovered successfully. So a little introduction again for those of you who may not have come last week. Dr. Izuka is a family physician at Straub's Ward Village Clinic and Urgent Care. He specializes in primary care for all family members, preventative medicine, and sports medicine. He's board certified in family medicine and received his medical degree from Loma Linda University School of Medicine in California. He completed his internship and residency training at the Naval Hospital in Camp Pendleton in California. He then served in the U.S. Navy for 7 years prior to joining Hawaii Pacific Health /Straub 8 years ago. Originally from Japan, he and his wife, Waka, and 2 kids now reside in Manoa. So Andy, go ahead and take it away.
Thank you, Jane. It's probably the longest introduction I have ever had. So thank you so much. And I just want to say thank you last week for those who are coming back in this week. Thank you for joining again. I just want to say thank you especially for George, Dr. George Kamura, who answered some of the questions. I'll be asking for his help. And there's actually several other doctors that are joining us too. Dr. Inez, their husband and wife, both are doctors. So, and then I think I saw, there's another doctor somewhere in there too. Anyway, I will be I said it last time too, but I don't claim to know it all. I also want to learn from this session. So I don't want to have people feel intimidated at asking questions. No question is a dumb question. I was taught that early in training. No question is a dumb question. So any questions would be welcome. With that said, I want to start with where we left off last week. We left off last week with a question, and the question was, what is the best treatment to prevent, or what is the best treatment for COVID? And I just want to clarify, it was probably worded wrong, and I just want to make sure, and then we talked about New Start. It's not really a treatment for COVID. I want to clarify that vitamin D, zinc, exercise, these stuff are all very important things, but it's not a treatment for COVID. So I just wanted to clarify that. And neither is it a cure. It will give you the best chance at fighting against COVID, but it is not a cure. So I just wanted to clarify that part in case anybody was confused with that part. We also, I'm not going to promote this week, but last week about 8 to 10 people stayed online on the Zoom, and then we had a chatting session for half an hour. A lot of people said, hey, that was the best part of the Zoom session. So we want it to be as informal as possible, as interactive as possible. So we will end at 7:30, but I want this to be an interactive session where people are asking questions and we're as laid back as possible. With that said, so Jane talked about vaccine. Well, first of all, let's start with the title. Is COVID here to stay? Anybody have an answer to that? Anybody think COVID's gone? If so, you're on a different planet. You might be on the International Space Station. COVID is not there, but COVID is definitely here. And I'm afraid that it is here to stay. So how do we live with this COVID? We just had a leadership conference at Hawaii Pacific Health. Our CEO, Ray Vera, who talks with the governor almost on a daily basis, told the leadership, which is about a 600 people Zoom conference, he said, I refuse any workers at Hawaii Pacific Health to use the word new normal, or new normal. He does not like the word new normal. And that's because it makes it feel like the old ways were the better ways, or we want to have the old ways as much as possible. He wants this to be an opportunity to make Hawaii Pacific Health better, i.e. bringing in telemedicine, video visits. So he wants to make this a learning opportunity and make medical care better. Perhaps Dr. Kawamura works for Kaiser. Maybe Kaiser is doing the same thing. I hope it is. But I just wanted to talk about that a little bit. And then Jane mentioned about the vaccine. There are 7 vaccine trials going on in phase 2, 3. A couple going on here, I think, in Hawaii, where it is done by University of Hawaii. A lot of the doctors have gotten the trial vaccine. So those are ongoing. It does take time to get the results. Realistically, it will probably be early next year that all of those results will be out. By the time it comes to our hand, by the time it gets administered, it'll probably be between spring and summertime, realistically. I don't think it'll be here for mass distribution before the spring, but it is possible. Now, is vaccine cure it all? Not quite, but it's better than nothing. It's definitely going to be better than nothing. I think the biggest thing that the vaccine will do is it'll take fear out of a lot of people's heart. And if it does that, boy, I'll take it. So anyway,
Dr. Izuka, though,
sure.
can you touch upon, because we talked about this last time. So a lot of what people are worried about for the vaccine, I guess, is like, I don't want to be the first person to take it because I'm worried that it's going to do something to me. So that, and then secondly, a lot of us have heard that it's only effective for 3 months or whatever. So what's the point of taking it? You talked about, you kind of compared the H1N1 vaccine and why that was still effective, even though it only lasted a few months as well. Could you talk about that a little bit?
Yes, thank you. So yeah, so the flu vaccine and the H1N1, a lot of people say, oh, I always get sick when I get that, so I'm not going to get it. Well, the thing is, it's boosting the immunity towards the virus when you get the shot. But what was proven with H1N1 was, the big thing about H1N1 was endocarditis. That's inflammation of the heart. That was the big complication that H1N1 caused. Now, people who got the vaccine, I don't think there were any cases of endocarditis or myocarditis. So now for this COVID vaccine, it's not out yet, so we don't know, but most likely it's going to lessen the symptoms that a person gets by having the COVID vaccine. Same with the flu vaccine. When you get the flu vaccine, when you do catch the flu, the symptoms are less. It's not as severe. And the safety of the vaccine, that's why we do these phase trials and phases. In phase 2 and 3, there's tens and thousands of people that are enrolled in these trials. And then if it's proven to be unsafe, it won't hit the market. So if it hits the market, and they will be publishing the details of the data when they bring it to the public. So we will be able to analyze the numbers, and we will be able to see scientifically that it is safe when it does hit the market. All right. So that's, any other questions about the vaccine? Okay.
And if you feel comfortable to unmute yourself. Dr. Izuka really wants that opportunity to talk to you face to face. Or if you don't feel comfortable, you can always drop it in the chat box and I can read it out for you.
I want to go, we'll talk more about COVID, but I want to talk about, I want to have Tara come on board now and talk about her story as a person who has had COVID. And then we'll talk more about it after she finishes her story. So Tara, if you could tell us about your experience of living through COVID.
Sure. I just want to start by saying, well, thank you, God, for me not having bad symptoms. But It was a bit of a roller coaster looking back. So for my birthday, my coworker and I went to lunch, and we share an office. And after lunch, he had a stomach ache and was like throwing up, and we kind of ate the same food. So he like texted me and asked me how I was feeling. And so that's kind of what started it. And so he didn't have a fever right away, but a couple days later, he had like symptoms. So he was encouraged to go get tested. And then I was encouraged to go get tested that same day. So I did. And just a little side note, his friend has a big company, and 3 of his workers, he's gone through a lot of this where his workers have gotten COVID and they've had to get tested. And one of them, which really kind of brought it home though, one of them gave it to her baby and and gave it to her dad, and he died, so anyway, so that's terrible. But anyway, therefore he was very insistent that that we go right away. And he said, Tara, you really want to know sooner than later. So I did get tested. And so just to show you what it feels like. So the next day, that you get the results like 24 hours later. So I was driving my son to like a birthday dinner. And while we're driving there, I get the text from my boss that he's positive. So when you hear that, I have to say, like, I've never really been afraid of COVID or paranoid about getting it. But when you feel that you have it, you immediately feel very like responsible for the people that you maybe weren't safe with or who you're around. And then your mind just kind of really goes kind of crazy thinking about that. So immediately we turned around, my son said, I can't go to that party because, I might have it, and so therefore, you do kind of want to know right away because of the people you might affect. But when I continue my story, you'll see why maybe testing too soon might not be good. So I was negative, and anyway, my boss, well, now I gave away he's my boss, but anyway, he kind of suffered. He never went to the hospital, but he had uncomfortable symptoms at home. He gave it to his wife, and she had uncomfortable symptoms. But so fast forward, this is like 10 days later, someone at my son's school, so this is a Friday night, goes around on the texting that someone has COVID, So I also forgot to mention that we had to test everyone at our workplace. So there's about 20 people. So we had to have them tested. And so that's, that was kind of stressful, but no one else had it. And 10 days later, because someone at his school had it, I felt, hey, I knew what the deal was, like, you want to know right away. So we both went and got tested, and that was on the weekend. And Monday, I find out that he's negative, but I'm positive. So then again, I'm on that roller coaster. Oh no, who was I around? And found out another coworker went to the ER with some like lung issues and like a pneumonia, he had like pneumonia. So we had to test all of our workers again, all 20 workers. Is everyone still there?
Yeah, we're here, Tara. We're listening.
Sorry, I just lost the screen. So anyway, so I kind of believe I probably got it from my coworker 10 days prior, but because I tested too soon, 2 of us. So that whole time, we're thinking we're negative. We were, I guess, positive, assuming that, you just kind of really don't know 100% if, where you got it, but I'm kind of suspect that we did get it from him. So, that's another thing to keep in mind, that if you do test too soon, it might not show up. So, but I will say that I did feel pretty much okay. The only symptoms I had was fatigue, maybe about 3 days, where I'm like, I feel pretty tired. This isn't, so I, take a nap. But that's about it. I never had a fever, and I never. But another, do I have more time, or another little side thing is that if you don't have symptoms, like per the CDC, you can go back to work without testing if you can go without symptoms for 10 days. So I didn't. So I wanted to go back to work, but my work kind of insisted that I go and retest. And so when I did, I actually went to Castle Hospital drive-through, and they did a great job. They kind of encouraged me not to, because there are a lot of positives after. And I said, well, my work kind of wants me to get that clear. So I did test, and I was still positive. So that was, 10 days later. So then I stayed at work.
Tara,
So I was out of work for 3 weeks. So essentially.
Can I ask Dr. Izuka, you know how she was saying like even Castle was encouraging her not to? Can you explain why that is? Is she still contagious if she has no symptoms and it's been 10 days since she got that positive?
Yeah.
I just want to understand why they would say don't test.
So let me share.
Maybe that was off the record.
let me share a screen. I'll share a screen that it's not this screen that you're seeing right now, but let me see, where did that go? Okay, here we go. Can you see this graph? Are you seeing a graph right now?
Yes.
Okay, so if you take a look at the graph and you see the arrow that I'm pointing, where the blue line starts right here, this is the day of exposure, so day 0. And then the line right here is day 7 and day 14 over here. So if we test right at exposure, it's going to be negative. So these white dots are negative for PCR testing. Obviously, prior to exposure, it's going to be negative. After exposure, it takes about 4 or 5 days before a PCR test will be testing positive. So at Hawaii Pacific Health, I'm not sure at Kaiser, but or Castle, it sounds like Castle is following CDC guidelines, but we recommend patients to wait 5 to 7 days post-exposure. I stay quarantined, but wait 5 to 7 days before you get the PCR testing from the day of exposure. And this explains, the blue line is the viral load, so the amount of virus that's in your body. It has to reach a certain point for the PCR to pick that up. It takes a certain amount of days for the virus to replicate and have enough numbers to be able to caught by PCR. And it hits that number around day 3, 4, and 80 to 90% of the people will hit it by day 5. And that's why we recommend day 5 for the testing to have the highest sensitivity. And then you can see the peak is day 7. We recommend immediate quarantine because the infectious period starts a couple days before the PCR test positive. So about 2-3 days after exposure, you could potentially be infectious even without symptoms. And that's why we recommend immediately isolating or quarantining so that you don't infect other people. And then you're infectious for about 10 to 14 days. But Tara said she got tested again afterwards, and you can see here later on at day 14, PCR test will still test positive. For some people, it'll test positive after a month, but that doesn't mean you're infectious. It just means that the viral particles are still somewhere in the body. And that is why, oops, I stopped sharing. There was another one that I was gonna share. Let me go back to the screen sharing. And that's kind of why you've probably heard of the pre-travel plan that the state is coming up with. So the pre-travel plan looks like, not like this, but like this. So this, I think, explains it very nicely. So there's like 1, 2, 3, 4 options. If you test 72 hours prior to departure and you continue to have no symptoms and the test comes back negative, you no longer require quarantine starting October 15. I'm not sure if this has actually been signed in yet, but that's the proposal at this time on October 15. And that's why 3 hours before? Because of that PCR test that we just talked about. No testing, then you have to quarantine 14 days. If you test positive, stop and quarantine or isolate right away. So just wanted to throw this out there in case anybody had any questions. So that's kind of the PCR testing and what it means. Now it's not 100%, it's only 60 to 70% sensitive. And the reason for that sensitivity is probably because people are testing too early. If people tested at day 5 to 7, the sensitivity probably is a lot higher. So
That was a really good explanation. I've always wondered, so thank you.
yeah.
Did you want to continue with Tara?
Yeah. So Tara, thanks for sharing your experience. How did you feel? You know, I really like the way the moment you heard positive, it's not like a cancer diagnosis where you don't hear anything else after that, but you start worrying about, oh, who did I come in contact with? Mm-hmm. How did others feel about you having the positive test? Can you share that experience?
Well, I immediately stayed home after that, so I don't know. I did get a lot of support, and a lot of people were bringing me food, and it was just really, touching how and I felt kind of guilty because I'm like, I feel fine. They were treating me like I was dying, and I was like totally fine, but just had to stay home, But
could you explain, because we talked about this before, did your son ever test positive?
No.
Interesting.
And I can't say, sorry, there's a helicopter. I can't say we were I didn't totally quarantine in my room the whole time. Like if I was around him, I would wear my mask, but I can't say I totally followed the rules regarding that. And I had another friend staying with me, and she never got it either. And we, and even during that time that I didn't know I had it, I guess we weren't being super careful in our house. So, but another side note though, I am pretty into health and prevention. And I thought it was funny that my coworker started texting me, the things that he's like, oh, I need to take vitamin D. I need to take zinc. And I just had to laugh because I said, you're supposed to be taking all of this before. This is called prevention. We want to prevent. We work on our immune systems before. We don't want to do it once we get it, But of course, once you get it, it will help as well. But
yeah, and kind of adding on to that, after the session, somebody asked, I have asthma. Is that a risk factor for COVID? So the answer to that is, according to CDC guidelines, if it's moderate to severe asthma, it is a risk factor. But if it's mild, they don't qualify it as a risk factor. So the question is, what do you mean mild, moderate, severe? So asthma people use these inhalers that you puff into your mouth. If you use that rarely, you have mild asthma. If you're using that every day, or if you have a other inhaler that looks like a disc, if you're using that every day, then you have moderate to severe asthma. So if you're using a daily prescription medication for asthma, then yes, that is considered a risk. But if you're occasional inhaler user, we don't consider that to be a risk factor for COVID. So just wanted to, in case anybody had asthma or had questions about asthma, that's the case. Now, COPD, people who have been smoking for a long time, that's a huge risk factor. And the difference between asthma and COPD, asthma, the lungs are react once there's something once there's an abnormality. But if there is no allergy or something that causes the asthma, their lungs are functioning perfectly fine. On the other hand, COPD, the lungs are already damaged. Irreversible damage has already been done with COPD patients, and that's why it's a larger risk factor. So smoking cessation would be highly recommended during this time of COVID. If you were never motivated enough, this would be a good way to put a stop to smoking. Or if you know somebody who's a smoker, say, hey, now you better stop.
Could you remind everyone what the, you mentioned that in Hawaii, the hospitalization rate has been about 2%. Did you say that? Am I correct?
Yeah, about 2%.
But it was either higher beforehand, like back in March, or we thought it was going to be higher because we were basing it off of Europe's mutation or whatever, right?
That's correct, yeah. So the prediction, the predictive models that we had, because the limiting factor for us is the hospital capability. How many patients can we, are we able to take care of in the hospital, and how many ventilators do we have? That's kind of the rate limiting factor for our state. And so we wanted to kind of estimate on the safe side. So we were saying, okay, let's say 10% of the people require hospitalization. Well, that if we had 50 cases per day, we would reach that number. Obviously, we've been hitting that number for months now, and then we haven't punctured the hospital system. So now we know it's around 2%. So then the number of cases per day is about 150. If we start hitting 150 all the time, we're gonna pretty soon hit our maximum bed capacity in the hospitals. And this is number of beds combined: Kaiser, Queens, Straub, Tripler, and Castle, all the major hospitals numbers combined. And there's a group of doctors who take a look at this daily, Josh Green being one of them. And I think Dr. Inai gets a report every day too, at least for Hawaii Pacific Health, for the ventilator use, because it does affect the hospital too. It affects the surgery cases that we do. It affects the colonoscopies that we do based on how bad the hospital situation is. To reassure everybody, we're looking very good right now. The number of hospitalizations are going down. Census in the hospital is going down. So we're headed the right direction.
Was the percentage ever higher? Like, was it higher than 2% hospitalization before? And has it come down? And if so, why? Is it because younger people are getting it now? And
yeah, so we were basing the numbers based on New York, which was at the time the only state that was having a major outbreak. So that's why and there, yes, because people weren't wearing masks. I mean, so much was unknown at the time. We didn't have as good treatment. So much was unknown at the time. So that's why we saw higher numbers. Numbers have come down quite a bit across the states.
And could you remind everyone what the death rate is in Hawaii? And is that the same as in the nation?
Yeah, so Hawaii, we have a real good number. I mean, it's less than 1% or around 1%, 0.9 to 1% is the death rate. Statewide, it's about 2%, and it's been pretty steady. Worldwide, it's about 3 to 5%. So it's come down compared to March when it was around 10%, 5 to 10%.
For Hawaii or for worldwide?
For the worldwide. I mean, Hawaii, we were at 0 back then.
Okay.
So.
This isn't talking about population. This is of those that are hospitalized or infected, or what percentage are you speaking about?
This is of the population that has tested positive. So you take the death divided by the number of people who have tested positive. Now, the true rate of infection, we're estimating could be up to 10 times as much. So because if Tara never knew that she had the contact, she probably would have never gone for testing and would have never known that she was positive. So we're thinking maybe the true number might be 10 times higher, which could bring the death rate even lower. But that number is hard to tell. But it's when we did the massive testing of I think it was about 60,000 people on the island, the rate, the positive rate was around 1%. So it tells us the COVID is not as prevalent as we may have thought. So I don't think 10 times. So in Hawaii right now, we have about 11,000 cases that have tested positive so far. I don't think we have 110,000 people who have already tested positive. I don't think so. 10 times I think is a way overestimated number.
Was there ever a time where the government interfered with how we treated the COVID patients? Because in some states, it seemed like they're not allowed to treat them certain ways.
No, as far as I know, Hawaii has always been very science-based, physician-driven. I have never heard of any influence from the state or the government, at least for Hawaii Pacific Health. George, how about Kaiser? I think you might know a little bit more about Kaiser.
I haven't heard any interference from that. I think you know, the infectious disease doctors are really in tune with the experts' latest information and data, and they're briefing us all the time of what's the new thing that's come out, and doing journal clubs, basically explaining what information out there for latest treatments. So yeah, I think it's been pretty open.
And you know, Dr. Inai, I don't know if Christy Humi Inai is online, but if you can unmute and maybe share some of the military side. She was functioning sort of like the chief medical officer over there. Yumi, are you there? If you can share your experience with the military, that would be helpful.
Hi, my husband just got back from surgery, and so I'm not going to show him eating. But what was the question? Sorry. The rates of COVID in the military?
No, I think that's confidential, so you probably shouldn't share that. But was there any pressure from higher from the state or the government in the way we treat COVID patients?
No difference in the military as in any civilian side. Our population is pretty healthy, so we really didn't have that many critical cases of COVID to begin with. So Tripler was always pretty open in terms of COVID cases. Obviously, you know, we have a lot of ships and submarines in very tight quarters. So the spread was, you know, there, the potential and the risk was obviously there. But those that had the COVID were actually pretty light in terms of disease symptoms and severity.
Yeah, thank you. I think what Kenneth mentioned, maybe where the government may have had some influence is not so much in the treatment, but probably more in the testing. CDC has kind of sometimes gone back and forth. Should we test asymptomatic patients or not? That is still a little bit of a question mark. Should we test asymptomatic patients? In Hawaii, we are testing asymptomatic patients if they have had close contact. And we kind of went over the close contact definition last week. 15 minutes without a mask or without protection, any contact in close proximity, or 15 minutes with a known positive case. Yeah, 15 minutes, as long as you're wearing good protection, you can't even go past 15 minutes. Like if if that were the case, all doctors and nurses would be getting tested every day because we treat COVID patients every day, but we gown up. So. Okay, are there any questions for Tara or for us docs? I think there's one chat. I'm not sure what the chat says. As we speak, the president and the first lady have been tested positive for COVID-19.
Well, that was
Yeah,
breaking news to me.
Yeah.
yeah.
I have a question for Tara.
Big news.
Once you received that positive test, did you get a contact from the Department of Health?
No, I never did.
Really?
I mean, yeah.
Yeah,
I know
so,
that, Mhm.
yeah, go ahead, George.
Yeah, I know that. I guess within the past 2 weeks, they've been offering those who were positive to be residing in a hotel to basically be able to protect the family members who cannot be, you know, separated close enough because of their housing situations. And I've had a patient who was offered a place in a hotel within the 24 hours of the diagnosis. So they were right on top of it, and he was quite happy that this was offered to them. Then it's optional, of course, and he took that option. It was actually pretty good. I was impressed.
So is it optional and free, or is it optional and you pay for it? There's a difference.
And free.
Oh, wow.
And I said it last week, but I didn't say it this week. I probably should say it again. I want to keep this politics neutral, so I'm not going to go too much into the president and all that stuff. But I will mention what I have observed. And when Tara was infected, we had a different administration for Department of Health. Contact tracing was not existent, unfortunately. Hardly any of my patients were contacted by Department of Health. Now, most of my patients do get a phone call within 24 to 48 hours. So I think there's been a huge boost in the Department of Health contact tracing, and that is a critical part in reopening our economy. And I think the governor and the Department of Health has learned the lesson. And I think we're hoping for a very different outcome as we reopen this time.
There is a question from Alvin, and I'll read it because he wrote it in the chat. Unless you want to unmute yourself, you can ask too. But what does science say about the virus contraction through the eye tissue?
So the virus can come in through any mucous membrane, and eye is very rich in that. And so if people remember, the first case that became very, that the media picked up right away was the doctor, the ophthalmologist, the eye doctor in China who passed away. Some people were saying he got killed because he talked about the Wuhan virus. Now, that's a conspiracy theory, and I'm not going to get into that. But the scientific answer to that is most likely he contracted the virus because he gets close with patients, and it probably got in through the eyes, although who knows, but eyes is definitely a way. If we rub it, that's why we have to wash our hands 20 seconds, is because we touch everything with our hands, we scratch our eyes, we maybe dig our nose if we're young kids or young adults. We touch our mouth, so that's why it's so important to wash our hands. So yes, it can go through the eye. There's got to be more questions out there. I know Jane. So Jane, one practical question. So I'm actually giving a similar talk next week, not for Halekokua, but for Hawaii Pacific Health. We're holding a Zoom community event, and there'll be 4 doctors on the panel, and we did a practice run today. And one question was the same question that Jane asked to me: can you get COVID from going shopping in the grocery store? You see people wearing gloves as they go shopping, and then you see people using sanitizers to wipe down the vegetables and fruits before they even bring it into the house. Is that necessary or not? Well, it is necessary to wash the fruits and vegetables because it's full of pesticides and other chemicals. So it's good practice to wash the vegetables. But so for the virus to live and replicate, it requires a live organism, such as humans, animals. Fruits and vegetables and groceries, those are not live. So when the virus lands on it, it doesn't replicate, it deteriorates. In 1 to 2 days, they're dead, or they're gone, or they're not no longer infectious as far as we know. Different surfaces, different infectivity. So can you get it? Yes, you might if you're super unlucky, but the chances are pretty low. As long as you wash hands, wear a mask, and practice good hygiene. But there is no necessity. It's not necessary to wipe everything down with a sanitizer. Now, if you want to do that, if that gives you comfort, you can.
I think it's because you said, there's like studies showing that it can live on plastic or hard surfaces for X amount of days, or you yourself, you just said 1 to 2 days. And what if, I put my groceries in the, fridge before 1 and 2 days have passed. And so does it just keep living? And then do you, touch it later? And I think that's where the questions are from. But yes, there's also probably worse things you're ingesting if you're disinfecting things as well, right?
Yeah, and the other thing is if you cook it, boil it, put it on the oven or on the grill, it's going to kill it as well. So
there's another question. Are positive asymptomatic people extra resistant to the virus? Like, is their immune system stronger maybe? Or do they luck out and get a weaker strain?
yeah, I think the strain is all the same as far as I know. But people who have weaker symptoms definitely have a good immune system. People who are in the hospital, so I'm actually on the COVID unit right now, taking care of COVID patients at Straub. It's actually been very rewarding. My brain is tired every day when I come back, but it's very rewarding. But every single patient has medical issues. I don't think there's a single patient the hospitalized patient that is there that has zero medical problems. In fact, most of them have multiple medical problems. Diabetes being a huge one. High blood pressure, heart disease. These are huge ones that people have. So.
Dr. Izuka, and maybe this is very, very rare, but we always hear about that story in the media where some young person, super healthy, or that bartender, I don't know if he has any underlying health conditions, but supposedly have no underlying health conditions and they are really sick, or the long haulers who have symptoms for so long. Is there also, not anything could it also be that they just had a higher viral load, like if someone coughed directly in their eye or something?
Let me comment on that. I said I'm doing another presentation next week. One of the doctors, not me, another doctor mentioned, so we talked about mental health, which Dr. Mimi will be talking about next week. Because we only have one session with this group, we talked about mental health, anxiety, and depression. One thing that this other doctor suggested, number one thing we should all do is turn off the news, turn off the media. The news and the media sell their products by inducing fear. And I think the reality is a healthy person having real complicated course with COVID is very, 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 very low. It's like 0.0001%. It's extremely low. It does exist. We still have to practice precautions because we have to care for the vulnerable. But as far as putting in fear for the healthy people, I think the media is taking it the wrong direction. So I really agreed with that other doctor saying the best thing to do is turn off media, turn off your cell phone, and focus on the people you care for. Focus on your family. for your mental health. And Dr. Mimi might touch on that next week. I don't want to steal his juice for next week.
Here's another question from Valerie. Are there any indications as to why children are less prone to COVID? And is that true? And does it correlate to what you just spoke about, where it's about whether you have pre-existing conditions or underlying health conditions?
Whew, good question. And I don't know if less prone is the right word. Maybe less, because we do know that children can transmit the COVID, although it tends to be in the higher teenagers and younger adults that do transmit. So they can be carriers, but as far as them having symptoms, it's extremely rare, especially in children that are healthy. So we're at Kapiolani, we're really seeing zero, close to zero cases of COVID in the young age. And when we do, they do have medical conditions, obesity being the huge one. And let us not forget, our population, US population in the pediatric, obesity is becoming a pandemic. We as parents really need to look at what we're feeding our kids, because obesity is a huge thing in our pediatric population. And so just wanted to throw that in. Yeah.
Hey, Andy, were you going to talk at all about the more like preventative or how to build up our immune systems, or was I confused on that?
So yeah, I was going to save that for the last part, because that's the most important part, right? Is COVID is here to stay. I said early in the part, the vaccine will be helpful, but it's, I think all of these, my boss uses the example of baseball. We're wishing for a home run that would just get rid of COVID. That's probably not going to come. These are all base hits. So the vaccine is a base hit, and eventually we'll get back to home base, or we'll get through this cycle. But these are all base hits. And one of the base hits, or maybe a 2 base hit, is boosting, or maybe even a 3 base hit, is boosting your immune system. And last week we talked about it. We talked about the New Start program. Some of the other people have said the 4S. That's an interesting one. And I thought 4S, that's a good one. Sleep, which is part of actually New Start program too. Sleep is extremely important for your immune system. Yeah, I'm not here to sell any products, but the new Apple Watch, this isn't the new one, but the new update now tracks your sleep for you. And I'm reminded I get 6 hours and 47 minutes of sleep every night. That's actually not enough. You need minimum of 7 hours per night, 7 to 8 hours per night. So sleep is important. The next one is stress. Stress. Dr. Mimi will talk about that next week, so I'm going to leave that part one alone. The next one is sweating, which is exercise. So sweating is very important. And then the next one is, sorry, I'm from Japan, so I'm going to butcher the way you say this. Savor. Jane, correct me. She's laughing.
Favor?
So what you eat, nutrition, that matters. And that matters a lot, because it determines, it largely determines if, well, I shouldn't say it determines if you become obese or not, because a lot of studies are showing obesity may be in the genetics. It gets built into your genetics early on in life. So it's unfair for the people who have that genes to say it's what you eat, because that might not absolutely be true. And some people can just eat the most unhealthiest thing and still be like a stick. So yeah, I see Auntie Lynn shaking her head. I'm definitely not part of that stick group. Whatever I eat, I put on around my belly, but nutrition matters. So I kind of like that 4S, and it could be 5S where you put spirituality, spiritual health in there. But I don't want to steal that from Pastor too, because Pastor will be wrapping us up on the last session. So that's kind of preventative ways. It's not a cure for COVID, but it's a base hit that's definitely going to help us out in the society living with COVID. Were there any other?
I'm wondering whether any of you, I think it was yesterday's news, and I don't know which one, but where they said that a couple of the symptoms that really help to identify whether you have COVID or not, and maybe Tara, you can answer this question, and that is that they lose their sense of taste and their sense of smell. Did anybody hear that as two of the best indicators of whether someone has COVID or not? And this just came out recently.
That's a known factor for a while. That's a known factor since March. But it's about 30 to 40% of the people, maybe even higher. A lot of people don't have it, but if you do have it, along with fever, chills, it's a pretty good chance you have COVID. But Tara, you were about to say something, and I think Dr. George Karamura was about to say something too, so I'll hand it over.
I was just going to say that I think one day I slightly felt like my sense of smell and taste were a little bit dull, but I didn't know if I was imagining it, but it wasn't, it was just about one day. Dr. Karamura, what were you going to say?
I get to speak with about maybe 3 to 10 patients a day asking these questions about this long checklist of symptoms, whether to screen them to get tested, or after they are tested positive, I have to fill out the Department of Health reporting form, and I have to go through the list again. And I would say about half of them are reporting loss or abnormal sense of taste or smell.
Thank you, George. Yeah, and then I'm gonna, one more question that hasn't been raised that Jane wanted me to share before we go into prizes and questions, or question for prizes. But I wanted to talk about mask. Dr. Meany just took his mask off. So to wrap it up for my section, there's a few things we can do for these base hits where we can keep our loved ones safe, and that is, it's very simple. One is to wear a mask when you can't keep physical distancing, or if you're gonna be in a crowded place, closed space. So wearing a mask is very important. Number 2, keeping that physical distance for those who you aren't familiar with, i.e. non-family members or non-household members. Especially if you're around a vulnerable person. And then 3rd, washing hands very well with soap. That's all it takes. And then keeping a good immune system, the stuff that we just talked about. But the mask, the type of mask does actually matter. And you probably see some cool looking people going like this. They did a study to see how effective those bandanas were. And compared to the surgical masks and the N95 masks, they were pretty junk. However, it was still better than nothing. And that's why we still allow it, because those might be the only things they will wear. And if they wear it, it's still better than nothing. It will still catch the large droplets, which is the majority of the spread. So that's why we still say it's better than nothing. The best one is N95 masks, but recently they came out a report. Most of the N95 masks are made in China, and about 90 to 95% of them are not as effective as they claim them to be. So that's pretty scary, considering some of the healthcare workers are depending on those N95 masks as we go into care for the patients who have high viral loads of this. So I checked with Straub. We carry the legitimate N95 masks that have gone through scientific testing. I think Dr. Inaya wears them as she goes into, well, as she sees his surgical patients.
Andy,
Yeah.
I think, you know, for the rest of us who are not in the medical profession,
Yeah.
we had talked about this a little bit last time. Like, what can we wear? Because are the disposable masks from Costco just as effective as the surgical masks?
Yeah, so that's great. So the main reason for a mask is it does protect you a little bit, but it's more to protect others from you. So this is really more to prevent spread of the virus from whoever has the virus. Does that make sense? So
Yes.
if you wear this, it's going to catch everything here, or not everything, but most of it here. That's why something is better than nothing. There are different effectiveness in different masks, but for the general population, yes, cloth masks are just as good. They
How about
say
those
the three.
disposable masks from Costco?
Yeah, in fact, those are quite good. They're 3-layered, and then they're breathable, and they're quite good. However, they're designed to let air out this way. So when you cough, some of the particles go out back. So it's designed so when you're talking to somebody, you're not spreading it up front, but it might go backwards. So in the airplane, if somebody in front of you is coughing, you actually have to be more cautious than when somebody behind you is coughing. And I think airline companies should absolutely require masks, except children. It's going to be pretty hard to require masks on children. But airflow in the airplanes, it's a closed, tight space. So masks, I'm pretty sure every airline is requiring it, except children. So anyway, that's that. Well, we've hit 7:30. Let's ask a question.
Can we?
Yeah.
Can we say, Joanne, if you're here, can you put, so that whoever wins the prize, we have to know how to get it to them. If Joanne can put in the office phone number and or email address, and they can contact you to coordinate, that would be best.
All right. So the question is, can you give us the 4 S's that I mentioned? The 4 S's that I mentioned. Whoever types that in first is the winner. The 4 S's.
The 4 S's were the S's for best preventative, right?
Yeah. Best way to boost your immune system.
Oh, here's Valerie. Sleep, sweat, savor, and spiritual. She put the 5th one in there. You didn't ask for, you said the 4 S's. You didn't say which 4, right?
That's true. So that's still correct. Yeah.
All right, Valerie.
Now Dr. Mealy might be offended by that, but that's okay.
Do you have another question? So it'll either be t-shirts or tote bags and pens. And let me see if maybe Joanne isn't here. Let me look it up. Do you have other questions? You can do that while.
Okay, let's come up with another question. What is the death rate in Hawaii? Approximate death rate from COVID in Hawaii? All right, Renee gets it. It's approximately 1%, or if not less than 1%. So good job, Renee, you're listening. Okay, 3rd question. Jane, come up with a question for the 3rd question.
Yeah.
Last one. Can you come up with anything? Oh,
sorry, I wasn't listening to you at all.
based on the graph that I showed you on the
really
PCR testing and the viral load, what day would be the highest viral load or potentially the most infectious period? Day 0 being the day of exposure.
range too. So any of those days. Okay. Sharon says it first, day 5.
Actually, that's the day when the test starts testing positive, but
Oops.
that's not the peak. The peak
Day
for the
6?
viral load. Nope.
Alvin says day 6. Lynn says day 14. Ella says day 7.
Ella wins it. Ella wins it. Day 7 is where the, now I don't know if that's true or not, but at least that's what the graph, and that graph came out of New England Journal of Medicine. So it's a pretty credible article. That's where all the doctors go to for their research articles.
This is day 7 after exposure, if you knew what the exposure was, right?
That's correct. That's correct.
Great.
Thank you.
All right.
Jane, being a good lawyer,
contact-
always clarifying.
Please contact the office. Joanne put the number over there. Oh.
Okay, Jane, now your advertisement for next week.
Yes. Trying to see. Please come back next week. I know Dr. Mealy is on here. Dr. Mealy, if you can unmute yourself, because he will be the presenter next week, and it'll all be about emotional health. As you know, we're doing this because we wanted to have proactive ways, such as Dr. Izuka shared today, that you can have overall whole body health. Those are things within our control, and they're things that are proven best in order to withstand this time. So Dr. Mealy is going to be talking about combating anxiety, which a lot of us have during this time. And he'll hopefully be giving us some tips on how to do that. Dr. Mealy, are you listening?
I am listening, Jane, and yeah, look forward to sharing a little at that time about anxiety, maybe depression. I think a lot of us are having emotional reactions. I tell my patients when they say I'm feeling more anxious, I'm saying I am too. I think all of us are experiencing some emotional reactions to this catastrophic event that's occurring in the community. So we have a lot to share together. There are some things that make it worse for some of us, and we will talk about that. But what can we do about it? I think that's these are these anxious patients who keep calling, but yeah, we'll share some thoughts, and you'll share some too. We should have a very good discussion together. I look forward to it. Please join us.
So if you've already registered, you shouldn't have to register again. But if you think of anyone else you want to invite, please just send them through the website, halakukua.org, and they can register then, and they'll get a reminder email with the Zoom link. So we are definitely past 7:30 now. There's always a lot to talk about. So thank you so much for everyone who came, and we hope to see you again next week.
Thank you, Dr. Izuka.
Thank you. We will stop recording at this time, and then I'll hang around just in case you want to talk story.
Aren't you gonna
Thank you, Andy.
your husband?
Hey, Renee.
Oh, I should have introduced Kenneth too. He'll be there after Dr. Mealy. He'll talk about financial health.
We're gonna talk about that next week. I'll save that for then. How did y'all? People that won prizes, how do they get it if they're not local?
Oh, is someone not local?
Valerie, she's actually my guest. She's in California though.
Yeah. So there was a phone number there. Let's see. Did you see the phone number? Okay, I'm trying to. So 808-988-4343. And Joanne, the church secretary, can coordinate with her, and I'm sure we could mail it out or something.
Okay. Thank you.
I saw where she said something about Ina Quinns, and I was like, wait, I was trying to read it while I was also trying to pay attention to. Oh, stress. Okay, you're right. Stress was the fourth S.
What happened to sunshine?
Yeah, that's right.
And I do have a question for Tara. You said you got COVID, but your friends that was close by didn't get it.
They did not. No. Not that I know of.
raises a lot of questions because
And